Welcome to this video on SALT, a practical field guide for mass casualty triage. We will cover sorting, assessment, life-saving interventions, and patient transport when resources are overwhelmed. In this video, we will explain why standardized triage is essential during mass casualty incidents, describe the 4 phases of SALT, and learn how to apply the sorting and assessment steps to accurately assign triage categories. Mass casualty incidents occur when patient needs exceed available resources. Standardized triage provides a shared language for responders, a repeatable sequence for any incident, and a defensible ethical framework for decision-making. The SALT system was developed in 2008 by a CDC-sponsored working group. By synthesizing existing systems into one national algorithm, it has become the standard for mass casualty triage and training internationally. The SALT framework consists of 4 sequential phases: sort, assess, life-saving interventions, and finally, treatment and transport. These steps ensure an orderly response to complex scenes. Global sorting uses 3 simple commands. First, direct those who can walk to a safe area. Second, ask those who need help to wave or move a limb. Those who do not respond are assessed first. During individual assessment, ask 4 key questions. A no answer, combined with the judgment that the patient is salvageable, prioritizes them for immediate care. If the patient is not salvageable, they are categorized as expectant. During triage, SALT permits only specific, rapid interventions, such as opening an airway, controlling hemorrhage, or decompressing the chest. These actions are for stabilization only. Full treatment happens in the treatment area. Once categorized, patients are prioritized for treatment and transport. This includes immediate, delayed, and minimal categories, as well as expectant and dead, ensuring resources are allocated based on current scene needs. The 5 SALT triage categories are: immediate for life-threatening but salvageable injuries, expectant for non-survivable injuries given current resources, delayed for significant injuries, minimal for minor injuries, and dead for those with no signs of life. Immediate or RED patients fail assessment questions but are salvageable with available resources. They require urgent intervention and frequent reassessment, as their condition may change rapidly. The expectant category is dynamic. It identifies patients who are not survivable with current resources. However, they receive comfort care and are reassessed, as the situation may change if more resources become available. Delayed or yellow patients have significant injuries but can safely wait for treatment. Minimal or green patients have minor injuries and can often assist with scene support tasks while waiting. This master algorithm summarizes the flow, from global sorting commands to life-saving interventions through individual assessment questions, ultimately determining the patient's triage category. Finally, when managing pediatric patients, SALT uses a unified framework with minor adjustments. These include checking for breathing before categorizing as dead, and maintaining caregiver-child pairs to reduce distress and improve assessment reliability. When dealing with non-ambulatory patients, remember that the global sort is not a disability filter. Responders must physically scan for those who cannot respond to verbal commands. In hemorrhage-predominant incidents like blast trauma, prioritize bleeding control immediately, applying direct pressure, wound packing, or tourniquets during the life-saving interventions phase. Avoid common pitfalls, such as lingering with one patient during the global sort, or assuming the expectant category is fixed. Ensure you do not confuse expectant with dead, and avoid providing full treatment rather than only the permitted life-saving interventions during initial triage. Always re-triage as conditions change, and do not rely on voice commands alone. Triage is a continuous process. Reassess patients at the casualty collection point, upon entry to the treatment area, and immediately before transport. Always document the time and category during every reassessment, especially for patients in the expectant category whose status may change as resources shift. To summarize, sort the entire scene first, ask the 4 questions per patient, perform only permitted life-saving interventions, keep the 5 categories and the core ethic of doing the greatest good for the greatest number in mind, and always reassess relentlessly. Thank you for watching.